Hello, welcome to our project on disruptive innovations. This is Christy Shaver speaking, and I'm speaking on behalf of Elizabeth Sweeney, Christy Furr, Christy Lambert, and myself as an introduction to our project. At the right-hand bottom corner of each slide, you will see initials, and that will denote who is speaking on that particular slide. Our project will discuss the use of telemedicine and 1-800-MED, as well as the use of smart home technology. And we'll look at economic theory as we introduce these into the market for healthcare services. So as we look at disruptive innovation, some of the definitions that we found is this is technology that improves a product or the way that a product is utilized, that possibly will overtake or change an existing market by offering alternative options to that service. Disruptive innovations can transform a product that was inaccessible before and may have been inaccessible due to price. For this particular project, the disruptive innovations of telemedicine, 1-800-MD, and smart home technology will be discussed. So our first innovation that we'll look at is the use of telemedicine and 1-800-MD. So according to National Medical Staffing, about 90% of healthcare organizations already have or are planning to offer telemedicine as part of their services. Another source that we looked at showed us that more than 50% of our hospitals here in the United States currently have a telemedicine program, and that helps to connect rural and suburban areas. And reach those outliers, people that can't travel to the hospital or to the doctor's office. According to Managed Care magazine, we could save $200 million over the course of 25 years if people communicated electronically more and more. New generations will continue to demand quality services that are fast and efficient, which pushes providers to strive to keep up with that demand. So this model shows us medical services before the introduction of telemedicine or 1-800-MED into the market. So our A here is without telemedicine. It shows our demand and our supply curve are both relatively inelastic. Therefore not very dependent on price. They're also not affected much by any change in price at this point. So here we see the introduction of telemedicine and or 1-800-MD we introduce that into the market and provide that in conjunction with traditional services. And so as we do that, the cost of providing the service is decreased because we're able to be more efficient by providing services electronically. And so the demand curve here does not change and does not shift, but the supply curve does shift along the demand curve to the right and begins to flatten out, becoming more elastic because the quantity of service is increasing here, and does become more sensitive to the price change.
We're now moving on to another model which will show with telemedicine and 1-800-MD the price and quantity of medical services when that telemedicine is a substitute for the office visits. So therefore people are going to call the number and not go visit their physician in this instance. A is showing that in-office services provided prior to the telemedicine being used as a substitute. So you've got your medical services on the price line and the quantity at this point, and supply and demand are both relatively inelastic at this point. Now we have added point B, which is where telemedicine begins to replace the traditional services provided in the office by physicians. At this instance, the market share is stolen from that market of services provided in office. So you will see that the demand is going to shift to the left along the supply curve, which does not change in this instance. And it will flatten as it becomes more responsive to price and telemedicine becomes a substitute for the in-office services. Demand for office visits will decrease at this point. So in conclusion of that addition, that telemedicine can be used in conjunction with the traditional service provision to make things more efficient, and then it would reduce the cost overall to the consumer at this point. Telemedicine can be considered a substitute for the in-office services. That's going to decrease costs overall for the telemedicine producer and the person consuming that service. When you replace those in-office visits with the telemedicine, it will become disruptive to those traditional services and the service provision, because there is going to be cost savings and easier access when you use the telemedicine or the 1-800-MD.
The next innovation that we'd like to talk about is smart home technology. This is technology that increases independence and may decrease individual supervision. These are items such as sensors, alarms, things needed for safety reasons. Can also be automated medication containers or other monitoring equipment. As baby boomers move into retirement and their life expectancy increases, the overall life expectancy is increasing, population is aging, the number of individuals that require this additional care is going to continue to rise. The technology is especially useful with the elderly population and with the disabled, and it continues to become more innovative and widely used. Okay, the basic model for our smart home technology demonstrates the price and quantity of these traditional personal care services. And point A is where we're offering these services without smart home technology. The second slide for this model shows where smart home technology enters the market. We're using these services in conjunction with our traditional services. Monarch does this now. We have traditional services in our group home, and then also the smart home technology, alarms, and sensors. Service provision becomes more efficient when added to traditional services. You can see that our price has decreased and our quantity has increased. The supply curve shifts to the right along the unchanged demand curve, and it becomes more inelastic or less sensitive to price. And with this new technology, we're assuming that there's limited competition.
With this model, we're going to show how introducing smart home technology has an effect on staffing and personal services. With point A, this is showing that there's no smart home technology being used. The price of personal care staff and the quantity of staffing provided, or the services that the staff provide, are indicated with P1 and Q1, and the demand and supply are relatively inelastic. So with this model, we've added point B, which is showing the smart home technology entering the market. The price of the staffing services that were being provided does not change, but the quantity of the personal care staffing will decrease when the smart home technology is used as a substitute or an alternative to the traditional services. In this model, the demand curve shifts to the left along the supply curve, and it flattens, becoming more elastic. And it's very easily affected by the price of services because there is the alternative technology that can be utilized instead of having an individual care provider. So wrapping up our example about smart home technology moving into the market, without the smart home technology, individuals would be more dependent on personal care services provided by staff and assisted living arrangements. Once the technology is introduced, then people can become more independent. They can also be more selective regarding the services they receive, which makes them more elastic with it because they can pick and choose based on price. The technology can replace the need for direct personal care staff, which would reduce the staff needed. Monarch has done this in several locations where someone may not be able to stay by themselves or need direct supervision, but with the added technology, safety alarms, medication boxes to where they're notified when they need to take medication, they would need less supervision. That would mean a reduction in the number of staff that are needed. It also can prolong the time an individual can stay in their home and not have to go into a nursing home, and that would disrupt the traditional service delivery for elderly and for the disabled. The examples that we've shown of disruptive technology show that this technology can offer alternatives or enhancements to the traditional methods of service provision. If the technology is used in conjunction with the traditional methods, then it can allow for improved efficiency, and that's based on increased accessibility and the decrease in cost to provide the services. And when the disruptive technology replaces the traditional methods, then there is a disruption within those established markets. Our team met over a 3-week period to discuss the technology, draw the economic models, and describe the models, as well as create the PowerPoint presentation. Slides were divided up for the ease of presentation, for the recording piece, and in no way represent the amount of work each team member contributed. We welcome your feedback and questions. Thank you.